Hello and welcome to this next video. So we're going to talk about what you should be doing in the first 4 weeks after you've had your open heart surgery. So it's really important in these initial weeks, we want to try and get some of that movement back up into your upper body and to make sure that we don't have this happening. So it's very easy when you've had a surgery and you are in pain to come forward and to try and protect everything. You don't want a lot of movement, but what we really want to encourage in these early stages is to try and get some of that movement back. So it does help with the pain and it helps to make sure that you don't get this rounded posture, even more so than you might already have anyway. And it tries to help everything up. Another good thing about it is when we start moving our body, we actually increase a lot of blood flow around, and this can help with the healing. So you've probably already received a lot of this information from the hospital itself. So we just wanted to give you kind of a visual look on how everything, how the exercises and the movements run and roughly how long it might take you. So just nice and easy, we're just going to start from the top and work our way down. So sitting up nice and tall in a chair, you're just going to start by tucking your chin down towards your chest and then lifting it up as far as you feel comfortable. So looking down and then up again, and you're going to do this 5 times. 3, down, 4, and 5. Back to center. So this one's just to try and start getting that movement back through your neck again. So the next one also for your neck is just to turn your head from side to side, looking left and looking right. Remember to turn your whole face as well as your eyesight around with you. Again, you're just going for 5 times and you're aiming to do this twice a day. The next one we're going to do is shoulder shrugs. So bringing your shoulders up towards your ears and then pulling them all the way back down. So lift up and then pulling all the way down again. Up nice and tall and down. Number 4. And last one, number 5. Okay, from here we're going to pop our hands on our shoulders, so out to the side. So the first one is just coming in front, aiming to get your elbows close or in line with your shoulders at least, and then opening up, coming forward, and then opening up again. So with this one, you want to make sure that when you're coming back, you're not popping your chest out in front. So it's just a movement for your arms. We're not looking and we're not interested at this stage at trying to get more movement through the chest itself or through your thoracic spine. The other one while your hands are on your shoulders is just to do nice gentle circles, 5 going forwards and then 5 moving backwards. So just getting that movement back. Again, next one is crossing your arms across your chest. You're just going to bend gently from side to side. So you can do this seated or standing. It's up to you whatever's most comfortable or when you happen to remember it. Nice and gentle bends from side to side. The more you do it, the further you'll be able to go from each side. Coming back up to center, and we're just going to turn to our left, come back to center, and then turning to our right. So just twisting gently from side to side, only going as far as you feel comfortable. Remember, if you feel any pain with any of these stretches, you need to stop and you need to consult someone in your rehab team, so whether it's a doctor, a nurse, or somebody else involved, just to make sure that there's nothing going on here, because you shouldn't get too much pain. Or perhaps you need some different pain medications to help you get through these early stages. So the last exercise, or the last movement that we're going to do, relaxing your hands by your sides, you're just going to raise them all the way up forward, as high as you can, and then coming back down again. So if I go from the side, you're just going to come straight up, as high as you comfortably can, and then coming back down again. So your aim is to try and get up as high as you would have before you had your surgery and then coming back down. So it's just a nice gentle lift up and then coming back down again. And apart from those movements, you need to be making sure that you're doing your breathing exercises that the hospital gave you to try and make sure that you're filling up those lungs again and getting as much oxygen in as you can. The other thing you need to do is make sure you're continuing on with your walking plan, so making sure that you're walking every day Even if you just start off really small, really slow for 5 minutes and then trying to build up the length of time that you're spending walking, eventually over time you'll get fitter and fitter, you'll be able to walk for longer, you'll have less shortness of breath, your legs will be able to keep up, and hopefully you don't have any issues. But if you do, please don't hesitate to ask us. Thank you guys.